Todd, Medical Director of Athletic Heart of San Francisco, and I welcome you to the second episode of Your Heart Health in a Heartbeat. Today I'd like to talk about screening tests in general and why there is so much confusion about them these days. It seems that every other week there's a media report casting doubt about the value of mammography or heart scans or PSA tests, and then you'll have one group of people saying one thing about the value of the test, and then another group of people saying a different thing, and it gets to be very confusing. So what's the reason for that confusion? Well, in my opinion, the underlying reason is because we fail to make a distinction between public health and clinical medicine. And I'll tell you why. The public health approach to screening, which is the standard way by which we think about screening, is a public health approach. It's a top-down recommendation, and it's usually a very simple rule. It'll be something like, all men age 50 and over should undergo PSA testing, or all women age 40 and above should undergo yearly mammography. So something very simple, and the reason is because the idea is to apply the test to thousands and millions of people so that it can have an impact on the health of the population in general. And but the problem with that is that when you do these very simple rules that you apply mindlessly to millions of people, inevitably the benefits are not going to be as great as you anticipated. For example, the test may have limitations. A mammogram, for example, can show a nodule, and then if you do a biopsy, it can turn out that the nodule is not cancer, but it's something benign. And from a public health standpoint, then it may seem that the mammogram is, has caused a waste of procedures, and for the woman it may be, unnecessary biopsy and exposure to risk and that sort of thing. Another reason may be that you detect a disease, but the disease, may take years before it causes any symptoms, and therefore the person may die of something else. And so from a public health standpoint, it may be that you're detecting things that are irrelevant to the health of the population, and it's a waste of resources. And of course, there are cost considerations. Public health authorities and insurance companies have to make decisions about the resources they're going to allocate, and so they have to to go through very complicated cost-benefit analyses, and these are very tricky and they're very controversial because you have to assign a dollar value to a potential life saved, and that's quite tricky, and that's part of the controversy. Now, if you look at things from an individual standpoint, and say you come to my office and we set aside all the public health concerns, well, if we do that, then things become a lot simpler. And I'll give you three ways in which things are much simpler. First of all, you come to me and you have your own concerns, and presumably you're wondering if you're healthy. Well, I'm not going to immediately order a bunch of tests. We're going to sit down and I'm going to try to understand what your concerns are. I'm going to try to understand what your expectations are. I'm going to know your medical history and your life circumstances. And that's what we'll do first. And then based on that, I will make a recommendation about what I think is an appropriate screening procedure, for different conditions, whatever they may be. And then we can talk about the tests, and I can discuss the limitations of the tests and the costs, and we can make an informed decisions on that basis. And then you'll know better what you're getting into and what benefit might be. We don't adopt just a rote assembly line approach to this. We just do it carefully and individually. A second way that the approach individually is different is that the public health approach tends to pick a test and not budge, despite the fact that the technology for screening may change. And I'll give you an example. Up until this time, the main screening test for vascular disease is the blood cholesterol. Well, now we have heart scans, and we know that heart scans are far superior compared to the cholesterol test in terms of being able to tell whether somebody has plaque buildup or whether they're going to have the risk of future heart attack and whatnot. But it may take years for the public authorities to figure that out and change their recommendation and their protocols. But meanwhile, a proactive doctor can identify which technology seems to be more promising and make the changes accordingly. And then thirdly, from a public health perspective, there's a focus on trying to identify disease, and if the test comes back negative, that's viewed as having no value. But from the standpoint of the individual, say you come and you have a concern about a certain condition, and we do the screening test, then you will find value no matter what the test results. If the test result is positive, then we will have achieved the goal of catching it early, hopefully before there are any complications. But then if the test result is negative, to you it may be of great value because it may give you peace of mind. If you had a concern about this particular condition, you may find yourself to be relieved from that anxiety. So that's really valuable. So these are the ways in which I think an individual approach to screening is much more effective, and it's not subject to all the controversies that a public health assembly line type approach to screening is. And so I hope you found this video informative. And as always, on the blog of the athleticheartsf.com website, you will find the show notes for this episode. And if you have any questions that you would like me to address, I invite you to contact me through the contact page on the website. And there's an email address, and you can send me an email. And if it's suitable, I'd be more than happy to try to address your question in the setting of a brief video like this. Okay, so thank you very much. And until next time, have very happy holidays.